Hello and welcome to our event, Assessing Pandemic Impact on Freight Logistics for the Victorian Healthtech Industry, delivered in partnership with Global Victoria. My name is Jeff Malone and I'm the CEO of BioMelbourne Network, and it's my great pleasure to be here today to open the event. I'd like to begin by acknowledging the traditional custodians of the country throughout Australia and their continued connections to land, sea, and culture. I pay my respects to their elders past, present, and emerging, and extend that respect to all Aboriginal and Torres Strait Islander people who may be online today. I'm personally joining you from the land of the Wurundjeri people of Kulin Nation. The COVID-19 pandemic has created a significant freight and logistics challenge for the Victorian Healthtech industry. We've partnered with Global Victoria to bring attention to the obstacles faced by our sector and the potential risks and impacts going forward. With a comprehensive industry review now complete, we've gained a deeper understanding of the current use of air freight transport, how organizations have shifted to adapt, and what is needed to support the sector going forward. To share the results of this review and their insights on the challenges at hand, we're very pleased to be joined by Derek Kear, Manager at Deloitte, Brett McPherson, Sub-Regional Business Development Manager, Australia and New Zealand at World Courier, Nathan Smith, Business Development Manager at Cell Therapies, Air Vice Marshal Margaret Stade, Australian Government Freight Controller with the Australian Government, Eric Schmidt, Senior Policy Advisor, International Policy, Department of Jobs, Precincts and Regions at the State Government of Victoria. So thank you all first. Of course, Sean Chung, partner at Deloitte. So thank you all for being here today. I'd like to thank Global Victoria for their support and for their ongoing partnership. Global Victoria is the Victorian Government's premier trade facilitation agency, connecting Victorian exporters with international buyers and business leaders throughout its network of 23 international offices. BioMelbourne Network have been partnering with Global Victoria to help drive their Trade Alliance program for the health tech sector. The Alliance aims to help Victorian exporters adapt their export strategies to respond to the rapidly changing global market conditions. This is a $4.7 million initiative to support the Victorian Government's $15.7 million export recovery package. Today is the first of many opportunities implemented to support our sector. And of course, thank you to you, our members and colleagues, for dialing into this session. In terms of housekeeping, attendees have been muted for the duration of the event. However, we do encourage you to submit questions or comments to our speakers via the Q&A function and to do so throughout the event. We'll address your questions during the Q&A session following the presentations. It's now my pleasure to introduce our first speaker, Derek Kear. Derek is a manager at Deloitte's healthcare advisory team with broad health sector experience across a wide range of organizations. Derek will be providing an overview of the freight and logistics industry report as it relates to us as a sector. Welcome to the event, Derek. Thanks. Over to you.
Thanks, Jeff. And hi, everyone. My name's Derek Kear, and as Jeff mentioned, I'm a manager with Deloitte. We've been working with BioMelbourne and Global Victoria for around about the last 2 to 3 months on this project, looking at the impacts of COVID-19 pandemic on air freight, and really trying to understand those impacts from a health tech industry's perspective. In considering that, we really tried to recognise that whether it's running clinical trials, manufacturing medical devices or pharmaceuticals, or operating commercial labs, all parts of health tech have been impacted by the pandemic and the air freight challenges that have come about from that. If we go to the next slide, Jeff's probably already touched on a bit of that background to the project, so I won't sort of cover that again. But in terms of thinking about the purpose of the work that we've done, it's really about trying to raise awareness of the issues that the health tech industry has faced over the last sort of 18 months. And really, we want to acknowledge a lot of the great work that the industry has done within itself to try and adapt to those challenges. And then looking to the future, we're really trying to identify what are the opportunities for the sector to consider in terms of how we sort of adapt to a new normal going forward. In terms of the process, there was a targeted consultation program. We spoke to around about 10 organisations across both the health tech industry, freight and logistics industry, and government, as well as a survey of BioMelbourne's members. And we had that survey went out to around about 250 responses, and we got sort of about 40 or 50 replies to that survey. So we've had a really good response rate, I think, out of that process. Next slide, please. In terms of setting the scene for this piece of work, I think it's really important to reflect on some of the unique needs of the health tech industry. And through our conversations with industry organisations, it's really been sort of interesting to hear about some of the very specific challenges to the health tech sector that might not be such a challenge for other industries in considering how air freight impacts on them. And I guess the first one here is really around the regulatory environment. And what we've heard and what we know is that when you're thinking about pharmaceutical manufacturing, medical device manufacturing, you've got organisations such as the TGA who regulate that very closely, and really thinking about how organisations can try and pivot. It makes it more challenging. There's certain approved ingredients or approved materials, and it does limit sort of options in terms of being able to sort of pivot supply chains at short notice, which has really been something that's come through this process. I think related to that, we've had a look at a lot of suppliers or a lot of health tech organisations rely upon suppliers where there might only be a handful of those organisations that produce a particular product globally. So there's a lot of these, I guess, very sort of long-term relationships that have been developed within the sector to support the raw materials and the supply chain. And it's not easy to sort of pivot to new providers as a result of that. I think when we then think about sort of fresh samples, the ability to sort of comply with clinical protocols is a really key issue. So we've heard about sort of fresh samples sometimes needing to be delivered within sort of 24 hours. And in terms of some of those clinical protocols, it really is a case of hours make a difference. We have heard through this process about stakeholders who source fresh samples from overseas, and their overseas suppliers have stopped shipping product to Australia because of the lack of certainty around transportation timeframes and schedules. So again, it's something that is fairly unique to the health tech industry. Temperature control requirements, I think it goes without saying that a lot of what is produced within health tech does have a sort of very sort of particular temperature control requirements. And we've heard about organisations who you can't go with a standard courier company because products need dry ice to be topped up on the tarmac while they're waiting to be flown out. So again, there's those sort of additional complications and challenges that have really had to be considered in how do health tech industries try and continue in this challenging environment around air freight. And then just on that last point, I think particularly over the last 18 months or so, a lot has been made of probably, particularly around the agricultural sector, the value of some of those exports and particularly large volumes, and whether it's lobster or beef or whatever else. But I think when we look at health tech, what we need to recognise is often we're talking about something that might fit in a shoebox, but it's very high value, and I think we can't lose that. So next slide, please. In terms of the key issues that have come out from this process, I think touching on these reasonably briefly, lack of awareness of government support for air freight and logistics. That's not from a want of trying. BioMelbourne and Global Victoria and the sort of Commonwealth, I think, hosted a session sort of late last year around the Commonwealth's industry international freight assistance mechanism. So there has been some work around that, but what we've heard is that organisations within health tech haven't particularly sort of taken up some of those opportunities. And I think there's a bit of a perception there that some of those current mechanisms are maybe more targeted towards the agricultural sector than being particularly specific or applicable to health tech. So it is something that I think there's an opportunity there to think about how can health tech leverage some of those opportunities. I guess the only other point I would make on that is that what we have heard is there's potentially been an indirect benefit of some of those programs. So IFAM, for example, has enabled more flights coming into and out of Australia, and there has potentially been an indirect benefit of that to health tech. In terms of the next 2 points, increased freight costs, we've separated out between exports and imports because there is a slight nuance to it. And in terms of the freight costs on exports, what we've heard is there's kind of two different elements to this. The first is that with freight on exports, if the Australian manufacturer is paying for that freight, then it's essentially increasing their cost of production and cost of sales. And what we've heard is there's limited opportunity to pass that on to customers. A lot of organisations have been able to bear that cost in the short term, but whether that's sustainable in the longer term is a real question mark. And I think we're obviously starting to see a bit of movement on international borders now, and I think that's certainly going to help that equation. When we think about the increased freight costs on imports, really that's driving up the cost of raw materials, which then has a flow-through effect. Again, organisations are bearing those costs. I think the longer term concern to this is when, particularly if we're thinking about contract manufacturing, when those contracts come up for renewal, if there is a cost increase that's being passed on, does that, I guess, create an incentive for particularly overseas customers looking at, could we produce this or purchase this closer to home, both from a cost of the goods, but also from a cost of getting the goods to them overseas. In terms of increased lead times, I don't think it's probably any surprise to anyone on this call that has been a fairly major impact of the pandemic, with a lot fewer flights coming in. Sea freight in itself, which I'll touch on in a second, has probably been impacted even harder than air freight has. And so there has been this sort of flow-on effect where organisations are having to plan a lot earlier around their supply chain. Organisations are needing to order earlier, potentially order more. And I think that lead time issue is something that we have heard from a couple of different organisations we spoke to about occasions where they've kind of been concerned about, is this going to start to have an impact on our ability to produce goods because we're still waiting on product coming in. And as I touched on briefly, sea freight, what we've heard is that sea freight is, if anything, probably in a more challenging position than air freight is at the moment. Sea freight's probably not historically been a hugely applicable option for the health tech industry, recognising that it is sort of generally lower value or higher volume products where you can afford a longer lead time. And so I think the reflection on that is it's the pandemic has meant it's even less viable than it would otherwise be. Next slide, please. In terms of reflecting on how the sector has adapted to some of these challenges, I think what we heard through the process of the consultations is there's been a lot of really good work to try and, I guess, adapt pretty quickly and pretty rapidly, and particularly when we look at March and April last year, organisations having to make really quick decisions around how do they pivot to try and ensure continuity of their supply chain. We've heard a lot about sort of strengthening relationships with freight forwarders and airlines, and I think a lot of health tech organisations have spent a lot more time and effort in sort of developing those relationships, potentially working with multiple different freight forwarders, going directly to airlines to try and look at sort of diversifying their options, really. I think increased focus on supply chain planning, I've probably touched on this a little bit, but it is we've heard a number of different approaches to this. It's ordering earlier to try and minimise the risks of delays, ordering more frequently, which is about minimising some of the variation in costs of importing, and also ordering in larger quantities so that they can try and amortise the freight cost over a larger volume. So there's different organisations have taken different approaches to that, but I think it is just to recognise there has been quite a bit of work there. Diversification of supply chain. I think the thing to note here is, and as I touched on at the start, it is a highly regulated environment. So this has been an option for some organisations, but others, it's much more challenging because they need to go through approval processes to be able to change their manufacturing process. It's certainly something that I think is a challenge that's not easily overcome. But certainly organisations have been looking at other alternative suppliers that we can look to. In terms of investment in research and development, what we've heard about is organisations, rather than trying to ship things in refrigerated containers, actually looking at, well, can we work to try and almost develop an esky-like container where we are controlling the temperature in our packaging, and therefore we can ship it on a normal freight container. And the magnitude of difference in cost is sort of 2 or 3 times. So that is something where trying to reduce those cost impacts has been really key. And then looking at operational efficiencies. So organisations have recognised that the freight side and the logistics side of their business, the cost for that is increasing. So what are other operational efficiencies we can look at? Are there other parts of our business where we can try and create efficiency? And I think the last thing I'll just touch on in this slide is around, despite a lot of that good work that's going on, when we surveyed the health tech industry, there's still 40% of people who believe that costs are unsustainable, 56% think that lead times are unsustainable, and 83% where sea freight isn't a viable alternative. So even now, there are still a lot of challenges. Next slide, please. And then I think this is the last slide. So just rounding out on sort of where we've got to in terms of next steps. BioMelbourne, I think, is looking to establish a working group, and Jeff might touch more on that a bit later. But really, we've tried to identify where we think there's the best bang for your buck from a working group in terms of opportunities into the future around how can we respond to some of these freight and logistics challenges. And I think one thing that we've sort of reflected on and heard through some of the conversations is how well the agricultural industry lobbied early on in the pandemic around the value of that to the Australian economy. And I think when we think about health tech, it is this thing, it's probably not as visible as agriculture, but the value of it is still huge. So how do we sort of get more advocacy around the value of health tech within the Australian economy? When we think about collaboration, thinking about how government, industry, freight and logistics sector can all work together to understand those unique needs and develop solutions that are going to be sustainable over a longer time horizon, and recognise there's probably still going to be challenges over the next 12, 18 months. I mean, I'm not going to crystal ball how long some of these COVID impacts continue, but I think we're certainly heading in the right direction with borders starting to reopen. Building local capability, this is really around looking at what we've heard is a lot of the challenges, and particularly for things like critical medicines, is actually getting raw materials in from overseas. So is there a role for there to be more local manufacturing of some of the raw ingredients that go into critical medicines within Australia, and really trying to build that sovereign manufacturing capability here in Australia? And there's obviously a lot of media around the mRNA stuff at the moment in terms of building that capability locally. And then sort of just the final point here is around infrastructure. And I think this is particularly looking at Victoria. And I think one of the things to help support the industry in Melbourne and Victoria is looking at what are the options around warehousing and distribution centres and refrigeration at the airport and things like that to really support some of those challenges that the sector faces. So I feel like that's been a bit of a whirlwind, but I will hand back to Jeff at this point, and thank you for listening to my piece.
Thank you very much, Derek. Really appreciate it. And the summary you gave was really comprehensive. And just to remind everyone, the report that we've developed will be made available after the event online in full. So you'll be able to see not only some of the insights that we found, but also a little bit more elaboration on some of the future considerations we'll have that we'll be dealing with in the working group and with the Victorian Government, and also, of course, with the Commonwealth. So with that, I'd also like to take a moment to just reflect that the information and insights we've gotten through this process have come from the cooperation and collaboration we've gotten from all of the industry partners and the members we've spoken to throughout the sector. Without their sort of generous giving of time and insight and taking the time, we had 42 different companies fill out our survey online, and we interviewed 10 or 11 organizations during this process. And again, thank you very much to everyone who got involved. It's really appreciated. So with that, once again, thank you, Derek, for that. Just a reminder for attendees to send through your questions and comments via the Q&A function. We'll address these for you towards the end of the event. It's now my pleasure to introduce our next speaker, Mr. Brent Ferson. Brent is the Sub-Regional Business Development Manager, ANZ, with World Courier. He spent over 25 years in the supply chain sector, managing clients and teams in both local and regional roles, covering a broad range of industries, including health tech. Brent will be providing an overview of the challenges faced in air freight with an international supply chain perspective. So with that, welcome to the event, Brent.
Thank you, Jeff. Thank you, team, and welcome. Good morning, BioMelbourne Network and guests. Look, I'm very privileged to be able to share kind of an insight from the other side of the supply chain fence to see what are the challenges that we're seeing and that we're facing in order to be able to support the industry around the world. So there is quite a lot going on, but I'll try and condense it as much as I can in the 6 minutes. Next slide, please. Just here on this slide, I just wanted to highlight some of the challenges, just in brief, of what's happening that's really specific to our sector. And then, as we all know at the start, the airlines are hemorrhaging financially. We look at the Pareto law, 80-20 rule, 80% of the revenue more would be passenger. So when you have over 16,000 commercial passenger flights or aircraft grounded in the height of the pandemic last year, and you can see here on that picture, that's actually Alice Springs. Currently, there's about 140 commercial aircraft just sitting there. A recent study was done. There's around about 300 hours it takes to get one prepped up, ready to go, to be able to fly again. So we're really looking at this being a prolonged challenge, and it's going to take a while before we start to see the volume coming back into the market. But the next point when we talk about it, which is what we're seeing is one of the major concerns globally, is the skilled labour shortage of the airport handlers. So as there was the mass redundancies or furloughs around the world because of the passenger freight, it affected all the aircraft handlers and the warehouses and over in all the airports globally. So we're seeing there being increase of mishandling. We can see errors, products being stored on the wrong flights, products being stored in the wrong conditions, and it's getting busier and busier, and the staff are just not coming back quick enough. And I suppose as an example, you'd see at your local cafe or restaurant, new staff coming into hospitality, you get a slower service, multiply that by thousands, and that's what you're going to see over in the air around the world. And my next slide, not yet though, will demonstrate a little bit of what we do on that one. Now the other challenges that we're seeing, obviously, is that sea freight. We've got companies that traditionally do move sea freight, can't afford to not have certain products. It's more commercially viable for them to do some emergency air freight. So that's taking up space that we never had allocated before, which is challenging. And less direct flight options. What that means is more handling. So that means more time spent at the cargo terminal operators, at the warehouses of the airports, which increases their chances again of missing flights and the like. Just to give you an example, in Melbourne before the pandemic, there was about 14 direct flights a week to LA, which is from the survey, one of the major players with everybody. Now there's 5. And that's an actual increase, because last year when Jeff and I were speaking and rallying with the Vic government, there was 0 flights in and out of Melbourne going off to the States that had to go via New South Wales. So we're really excited that we've got 5, but we're trying to obviously push for more. Those of you that import and export with dry ice may or may not be aware that there are actual capacity limits on the amount of dry ice that a flight can carry. Depending on the size, it does vary, but there are actually limitations towards that commodity on how much can actually be put on a flight, and that can increase your chances of being left behind. And the other chances that can leave it being bumped off that flight is non-compatibility with other commodities. A classic example is live animals. You can't put dry ice and live animals in the same cargo hold. So next slide, please. This slide here, I just really wanted to create a visual for you all to see what happens to a parcel, just a simple parcel. Say this parcel might be going from Chicago, no direct flights, but what that means, it'll go via LA, but each bullet point is a potential touch point. This is where it's being handled by another person, transitioning from another area. So there's 26 potential touches. So that's 26 chances of error, 26 chances of offload, and you can see those green dots there where it's got the airport, the cargo terminal operators. That's where we're seeing a lot of the congestion. Yeah, there's flights available and there are vans and so forth, but there is a lot of hold up in these particular areas. And just give you an example, in Melbourne, when we check in freight, so it's kind of like for cargo, but not for passengers, it used to be 2 hours before the flight was cut off. Now it's 6 hours before the flight. It has to be cut off. So all of a sudden, you're starting to extend the transit time of every single shipment. So you really need to be able to manage and to look at that. But then also, is that what you're shipping robust enough to be able to handle an offload in the middle of wherever it is on those direct flights, Singapore, LA, and can it go and extend? So we're seeing long wait times at airports, less payload per van with the drivers, and it's really increasing a lot of cost at the moment. The airlines are needing to recoup their costs, and will take a long time before they start to get that 80-20 rule back to where they want it to be. So it's going to be a long haul from where we're coming from. I do want to highlight too, one thing too is because of the survey results being in the US, I have been, there was an article, there is a mandate in the US for vaccine for the logistics industry. It's around about the 3rd or the 8th of December, around about there, where it'll be mandatory for wharf, all logistics, trucking, warehouse and so forth to be vaccinated. We're not sure what impact that will be to the supply chain in America, which is already crippling, but there's something to be mindful of also going into Christmas, where we've seen some airlines stop going into a particular airport because their warehouse had 2 weeks of freight just sitting there and they needed to be able to get it out. So there are a lot of challenges coming through at the moment. Next slide, please. This slide here I've used before in presentations. It's just a visual to show you what life looks like inside the belly of a freighter versus a passenger aircraft. When you're sending small parcels, dry ice and so forth, you can see it's a lot easier to get it out of the passenger hull, out of the baggage hull, often on the conveyor belt. But when you're looking at the freighter side, on the left-hand side, you can see it's consolidated. It has to be. It's a big production where all the boxes are put together and stored. So it takes them more time to load and unload freight, and it also takes more time and more handling at the warehouse at the airport, which, as we've just talked about before, is where we're seeing the biggest challenges from a labour shortage and skill shortage. The other thing is that freighters are not as reliable, or don't have to be, as from a timetable point of view as what passenger aircrafts are, and they can be changed very rapidly within 2 weeks. Whereas a passenger, as we all know, when we book our flights away on our family holidays and the likes, we can book it out 6 months in advance, and we know that that flight's leaving on Monday at 4 p.m. and so it does. Freighters don't need to follow that model. So when we're looking at all that, why not go sea freight? Next slide. Like just to put another visual up there, just a comparison for you all of what some transit times. These are the major lanes that you showed us in the survey of what you're trading with: Germany, New York, and India. These are only port to port. If you were to have a full container, you're looking at 5 to 7 days each side to get it off the vessel and into the facility. So already you're in the 50s and 60s with some of these. It's not viable. We cannot, there is no consolidation of options available to do small parcels on vessels at that temperature range that is not moved with food and other product that is not compatible. So there is a challenge there, and we're working really, really hard to make sure that we can support the industry and give Victorians, I suppose, that platform to be able to compete with the global market. So I hope that's been helpful. And with that, I'll pass it over to Jeff. Thank you.
Thank you very much, Derek. That's really great insights, and it's something that we've been talking about for a number of months, but it's not necessarily common knowledge. And really, part of the reason we're all here today is to help share some of the information and insights we have day to day dealing with the industry. So really appreciate that, Brent. Now it's my pleasure to introduce our next speaker, Nathan Smith. Nathan is the Business Development Manager at Cell Therapies with over 20 years experience in cell therapy and biopharma. He currently oversees Cell Therapies business development and collaboration activities and manages their client pipeline. Nathan will be providing an overview of the challenges they've been facing as an organization with international freight and logistics. And so with that, welcome to the event, Nathan.
Thanks, Jeff. I really appreciate it, the opportunity to talk to everyone and be part of this great panel. I think we've got some great voices here, and being able to provide a little bit of an industry impact, which is kind of the flavor that I want to add to this discussion. So just a little bit of impact to the supply chain from the Cell Therapies perspective, and just to give, next slide, please. Just to give everyone a little bit of background about who Cell Therapies is. We're a contract manufacturer based out of the Kear Cancer Center that focuses on cell and gene therapy manufacturing. And this is for translational programs for clinical trials, but also commercial supply. Specifically, at this moment in time, we're manufacturing Novartis's Kymriah CAR T product for the Australian market. Next slide. So, I don't want to take too much time, but I do want to, and some of these things have already been touched on by both Brent and Derek. And, all I want to do is really kind of put a little bit of an industry spin to it and what we're seeing and how we've dealt with it. So from the last, I guess, 18 months, the impact to our supply chain has been pretty significant. And that cost, like Derek said, is something we've had to absorb. It's not very easy for us to pass that on to our clients in certain instances, especially from the commercial manufacturing side of things. But as Brent pointed out, right, 26 touch points. There's no such thing as a routine delivery, and that's something that we had to really work on, is how we manage those our deliveries, the coordination that's required across all of these different groups, from the transport logistics, the couriers, the loading docks, all these different places. We have to coordinate and be on top of that, because a 2-hour difference can majorly impact manufacturing schedule from our side. And that uncertainty has a flow-on effect to our costs and our not just our costs, but our operations, right? We've had to increase our resource commitment in order to make sure that we're getting things when we need to get it, and so that we can coordinate that very closely with our manufacturing operations. So, that's, as Derek mentioned, there's increases to demand planning and logistics personnel that we need to have on our side to make sure that we're getting everything that we need in the right time. And then we have to have flexibility within our manufacturing schedule, which is difficult to do because we're not only are we doing commercial manufacturing, we're also doing clinical manufacturing, and everything can be really tight because we're trying to maximize our capacity during this time. And so and that doesn't impact just our manufacturing, it also impacts those support groups like our QC testing and our quality assurance teams that are overseeing and making sure that we're complying with the stringent regulatory requirements. And we don't have options in delaying manufacturing. I mean, these CAR T products need to get to patients because, some of these patients could potentially pass if they don't get this product. And so that timing becomes critical, and that, and again, that, and I know Brent knows this very well, right? We can't fail. We can't fail from the incoming product. We can't fail from a manufacturing perspective, and we can't fail from a logistics and transport perspective to get that back to those patients, right? And that's, part of those unique challenges for some of these cell and gene therapy products. And then, and I'm sure everyone has within the industry has felt the stock on hand issues, right? And over ordering of materials, how much, what is the cost impact there, right? And what are the flow on effects from those cost impacts, right? We have to have so much more inventory on hand just to make sure that we're not going to, fail from a manufacturing perspective because we don't have materials. And then when we have all that material, right, some of those don't have long expiry dates. And so what is the cost of that stranded or discarded stock that we have? And we've had to throw away some pretty critical materials because they've expired and we can't use them from a regulatory perspective. And then there's also flow-on effects from the inability to get certain items, right? And I think one of the things that my supply chain team was talking to me about was really about the plastic shortages, right, which were driven a lot by COVID and has made it very difficult to get even just normal plastics that are used in our manufacturing process that you kind of take for granted. That's a problem, and and that can be debilitating across the board if we can't get those on hand. Next slide. So some of the things that we've, I think we've put in, a lot of different protections and redundancies so that we can make sure that we catch and don't pass on some of these concerns to our patients, right? Because ultimately that's our concern. I think some of the things that we need to look and consider moving forward, and again, I'm reiterating some points that Brent and Derek have raised, right, is that, we anticipate that it's going to be 12 to 24 months before we actually start to see, so hopefully, some return to normalcy with freight costs. It was raised that, the sea freight's getting so much more expensive, right? Sea freight, from what we've seen, sea freight containers are about five times more expensive. And so that means that the cost of moving it to air freight, emergency air freight, is much less of a penalty, right? So a lot of times there's items that normally wouldn't be going to air freight that are now, and that's impacting everyone who uses air freight normally, right? And then we'll also need more flights. And I think, some of the points about we actually now have some, 5 flights from Melbourne to LA is great. And I think we just need to, we need to monitor that and continue to increase those as we can, because that'll help us drive down costs. That'll enable us to be able to ship more products back and forth, things like that. For these cell and gene therapies, these advanced therapeutic medicinal products, these costs, we're already paying a premium for everything because these are, we're using rare cytokines and media that's tailor-made for this process for T cells and and things like that, viral vector. All these things have a cost premium there. and now we're adding on, kind of premiums for freight costs on top of that, and all these costs start to add up, and it's not, and again, we can't pass this on easily to our clients. So without not being, remaining competitive globally, I think that's a big challenge. And I think Derek did touch on that, right? If we try to pass these on to our clients or on our next price review, they may, there's a potential that they'll look elsewhere. And that's a big problem from an Australian economy perspective, because we're known actually for, our ability to provide these type of products. They're high value product. A lot of the things that we're shipping are high value, and that premium cost is due to the temperature control and time sensitivity, because we need things, for some things that have to be or that are cryogenically stored, right? That there's a cost that's added to there, right? Or if it's a fresh product, right, that needs to be kept to us in a certain time period for it to be viable, and that can be very critical to the patient treatment. And then finally, I think one of the things that we've recognized is that we need to have some health tech specific subsidies. I think some of the programs that we have that have been implemented, again, don't prioritize some of those low volume, high value products. And I think because of that, we've really struggled to really be a part of those programs and to take advantage of some of those programs, just because they didn't end up, meeting what we need. And I think that's some of the challenge that we need to look at. So I think that's a snapshot from the industry perspective. I think, I'm really looking forward to seeing some of the presentations from the Australian government and the Vic government and the discussion moving forward. Thanks.
Thanks, Nathan. I really appreciate that. And it just encapsulates what we heard from so many of the organizations through our surveys and through the interview process. If anybody's familiar with lean manufacturing, there are the deadly 7 wastes, right? And what's been very apparent is that because of the pandemic, it is driving what used to be a very efficient industry into these 7 wastes: extra transportation or lack of transportation, driving waiting times, driving extra movement and extra handling, extra inventories, building inventories and storing them, ordering raw material inventories and storing them. And of course, all that has inherent risks in it. You might order materials and they go bad before you can use them. You might order materials and materials may have a quality issue, and suddenly you're a lot more exposed than you used to be. So it's driving not just air freight costs, but it's driving costs throughout and waste throughout the manufacturing process, and that's become very, very apparent. So it's well beyond an impact of just air freight costs. So really appreciate the insights, Nathan. Now it's my pleasure to introduce Air Vice Marshal Margaret Stead. Marg is the Australian Government Freight Controller with the Australian Government. She commenced her professional career as a military logistician with the Australian Air Force. Since then, Marg has refined her expertise across various roles, specializing in defense, national security, transport, logistics, aviation and aerospace, cultural change, and organizational transformation. With that, welcome to the event, Air Vice Marshal Marg Stead.
Thanks very much, Jeff, for the warm welcome. Good morning to everybody. I'm just going to give you a quick overview of the IFAM, or the International Freight Assistance Mechanism program, and just talk about some of the issues for air freight going forward that we see.
Thank you very much, Marg. And it never ceases to amaze me that every time we have you on the phone and every time we speak to you, we learn something new, and certainly get a sense that through your work and it's really been keeping a tab on what's going on and what the trends are, and we look forward to working with you going forward to help to try and collaborate and find solutions that help the whole industry. So thank you again. It's now my pleasure to introduce our final presenter, Eric Schmidt. Eric is the Senior Policy Advisor for International Policy at Department of Jobs, Precincts and Regions, State Government, Victoria. His work deals with the state's trade policy response to the COVID-19 pandemic, the associated challenges with air and sea freight, and disruptions in the Australia-China trading relationship. And with that, welcome to the event, Eric.
Thanks, Jeff. And good morning, everyone. It's good to be with you. If you can go to the next slide, please. Yeah, so to start out, I wanted to just try and give a bit of an overview of disruptions to the global supply chain. I think it's helpful to kind of see it from a broad macro perspective, because what we're seeing in Victoria is really just a microcosm of what's happening globally. So some of the challenges actually predate the pandemic. So in January 2020, some new rules came in regarding the sulfur content of shipping fuels. And this added substantial cost to shipping lines, which were then passed on through manufacturing and transport supply chains. It also forced shipping companies to scrap some of the older ships in their fleet. Then, as the pandemic hit in China, in late January 2020, manufacturing came to a halt, Chinese cities were locked down, and shipping companies took ships offline because of the decrease in global demand that they were forecasting. Then, as China got the virus under control and the rest of the world went into lockdown, we saw this massive increase in online shopping and a spike in demand for goods as people stayed at home. So all of these issues, capacity constraints, supply chain disruptions, air and sea freight challenges, they're all intertwined. And in some ways, it's turned into this massive negative feedback loop. I know sea freight isn't as relevant for this industry, but understanding how sea freight influences this is key, because 90% of all goods globally are shipped by sea freight. Early in the pandemic, we also saw a lot of air freight shift to sea freight. Then as sea freight prices increased and more air capacity came back online, for example, through repurposed planes, we saw increased demand for air freight among companies who were willing to pay that higher price. As Mark mentioned, shipping cat food by air freight. So as well, big global companies, so think of Walmart, IKEA, Apple, they started throwing their weight around, which further distorted supply chains as they took even more capacity offline by chartering their own planes and their own ships. They stockpiled their inventories and increased the frequency and size of their orders. Similarly, we saw huge shifts in trade lane demands. So activity really shifted toward those most profitable routes, specifically Asia to the US. As the pandemic progressed, ships, which were already running behind schedule due to congestion at ports, decided to begin leaving empty containers behind rather than waiting the couple days required to load them back on board. So as containers piled up at major import locations, their supply dwindled at export hubs in Asia. So in other words, the Asia to US trade routes have become so lucrative that carriers aren't even waiting for cargo before sending it back to Asia, before sending empty containers back. The heart of the problem really lies in the US. Most have probably read about the massive number of ships stuck off the west coast of the US, which has averaged about 70 for the past few months. This is happening for several reasons. First, US ports, even the big ones like LA and Long Beach, they're much smaller and far less efficient than ports like Singapore and Shanghai, where most of these products are coming from. Second, the US rail network is not able to handle the surge in volume that we've seen. But the biggest bottleneck of all in the entire system is the US cargo space at port terminals, which is translated into this massive imbalance, which is currently at 40%. So that means that for every 100 containers that arrive in the US, only 40 are exported again. So this is all leading to higher inflation as shippers pass these costs on to consumers. Then on top of all of that, you have this shortage of truck drivers in the US and Europe, rising global energy prices, what's approaching a full-on energy crisis in China, fears of Evergrande, shortages of pretty much everything, including semiconductors. So all of these factors are just making trade more expensive for importers and exporters, both in air and sea freight. Next slide, please. So this is a bit of the Victorian context. So Victorian supply chains have really been disrupted by a number of factors, the global ones that I mentioned on the previous slide, as well as some domestic factors. So things like closed state and international borders, if you want to call it a COVID elimination strategy, and stringent passenger caps. The reality is that all capital cities Melbourne included, have lost significant market share to Sydney over the past 18 months. We've seen this big shift in what pre-pandemic was really a much more balanced picture in terms of freight, passenger aircraft movements spread across Australia, to our current situation where air activity is much more concentrated in Sydney. Sydney's always been the dominant air freight hub in Australia, but it's gone from having less than half, about 40% of air freight pre-COVID, to now more than 60%. Over that same time, Melbourne's gone from near 30% to just 23%. And losses have been even worse in other cities like Brisbane and Adelaide. Another issue is that a number of airlines have pulled out of Melbourne. Because airlines plan their routes well in advance, airlines can't necessarily commit to servicing routes to Melbourne, or Australia in general for that matter, because they've shifted their fleets toward profitable routes between countries that have already opened their borders. The slow vaccination rollout as well, unclear timelines about international borders reopening, that didn't instill confidence in airlines either. Another challenge, and this is not a new one, is the leakage of Victorian air freight exports through Sydney, which is especially pronounced in the pharmaceutical space. So about 23% of all Victorian health tech exports are shipped through Sydney. So that chart in the middle shows the proportion of Victorian originated air freight exports that were shipped from Sydney in 2019, so pre-pandemic. The US is by far the most impacted market, in which more than 30% of Victorian air freight exports to the US actually went out of Sydney. So Sydney's large concentration of airline activity and logistics providers, plus the eventual opening of Western Sydney Airport, these are key challenges for Victorian air freight going forward. Just one more point to mention, air freight services earn about 3/4 of their revenue on import cargo. So the key to cheaper exports is really maximizing that inbound leg. And then just that last column, there's issues with regards to Victoria's seaport supply chains as well, but they've been much more resilient than air freight supply chains. Next slide, please. So I just wanted to use this opportunity to briefly put into perspective how the health tech sector fits into Victoria's overall export profile and how things have changed a bit due to COVID. So we're extremely conscious of the contribution that this sector makes to the Victorian economy. Exports worth $3.5 billion and employs more than 30,000 people. Pharmaceuticals are Victoria's second largest goods export. They make up 11% of our total goods exports, and air freight is a key component of that picture. So pre-COVID, air freight represented about 24% of Victorian exports by value, but only 2% of the volume. Probably won't come as a surprise to anyone, but air freight is especially important for the health tech sector. So health tech exports made up about 38% of Victoria's total air freight exports in 2019. And the US is by far the most important market. So health tech exports to the US alone accounted for nearly 1/4 of Victoria's total air freight exports pre-COVID. So I just want to repeat that the exports in this sector, in this one single sector to one single market, the US, made up more than 1/4 of Victoria's total air freight exports. It's absolutely massive, and it's extremely important. So for this reason, we've been strong advocates to Margaret's team, to the Commonwealth, on the importance of direct flights from Melbourne to the US, strictly because of this export. Both those charts on the right have the same format. So that top chart breaks down the top health tech products at a 4-digit HS code. And the bottom chart breaks down the top health tech export markets. So on the left-hand side, you have the export value in billions of dollars. And then on the right-hand side, you have the percentage change in exports over the year to 2020. So 2020 compared to 2019, their calendar years. So anti-serums and blood fractions, by far the most valuable, have been relatively flat over the year. Overall, exports in the sector fell by about 8%. And then that chart on the bottom shows Victoria's largest export markets, which are overwhelmingly the US and Germany. Both saw relatively small single-digit declines, but the US makes up almost half of all exports in this sector, and Germany makes up about 1/5. It's slightly less concentrated on the import side of things, but the US is also the largest import market, but it's only about 32% compared to half on the export side. Next slide, please. So yeah, I'll just use this slide to kind of explain what the state government is doing to alleviate some of the current challenges. The left-hand slide gives a bit of an overview of some of the day-to-day activities that government is involved in. So things like airline and investment attraction. This includes working with Melbourne Airport, attracting logistics providers to Melbourne, incentivizing companies to base themselves here, building up our importer profile, improving the state's competitiveness through infrastructure investments and upgrades, particularly our landside operations. So things like road and rail, attracting capabilities. So the recent announcement of the mRNA vaccine manufacturing in Victoria. The state government also has a key role to play in advocacy and communication. So through things like ensuring that the interests of our industries are accounted for in FTA negotiations that the Commonwealth undertakes. Data sharing, engaging with industry associations like the BioMelbourne Network. And then the state government also has an extensive network of overseas offices. So they're called VGTIs. And we have 5 offices in the US alone. So San Francisco, Chicago, Washington, DC, Boston, and New York. And we're rapidly expanding our footprint there. Given time, I won't go too into detail on the programs on the right, but I encourage you to contact our department, DJPR, either Global Victoria or Business Victoria, so they can provide you some more information about those programs. But if you Google them, all the information, if there's an opportunity to apply to them, it should be easily accessible online. Next slide, please. Yeah, so lastly, I just want to say that, this event it's really timely that we're having this discussion now. We're just heading into the peak air freight season in air freight export season in Victoria. The borders are reopening and the state budget process is kicking off. So I think one of the previous speakers mentioned how the agriculture industry had been so vocal in working with the state government and working with the Commonwealth government. And that's why they've had so much success through programs like IFAM. And there's no doubt about that. So I can't stress enough how important engagement is with the state and Commonwealth government to make sure that we have a clear understanding of the issues in your space, how you envisage support coming from the government, things like that, so that we can, make that case to government through our state budget process. And then finally, we have a couple dedicated specialists who work in DJPR, who strictly work in the health tech space. So Libby O'Connor in Global Victoria and Phil Davies in our Jobs Innovation and Business Engagement Group. I'm sure many of you probably already know them, but I'm happy to provide their details and happy to provide my own as well if I can help make connections in the state government. That's it for me.
Thanks, Eric. I really appreciate it. And it strikes me when I look at that chart of the exports and the value of the exports going out. I go back to the comment, I think it was Derek who made that the relative size and volume and weight of exports per value is much lower. And so when you're an air freight company and you're looking at shipping, unfortunately, cat food or vaccines, cat food's more profitable if you're an air freight company, right? Because they get volume and weight, and that's where they make the money. And so this is just all lends towards the facts that we need to make sure that the priorities we have for our industry are raised and clear. And as you mentioned, Eric, there's a whole process going on in the background, both with the Commonwealth and with the state government, to make sure through hopefully this working group we've got forming now, being able to clarify and collaborate and sort of co-design some of the incentives and initiatives that will go into the state budget and also into hopefully some short-term activities as well. So with that, thank you. I really appreciate that. But before we head into the panel Q&A discussion, I'd like to welcome Sean Chung. Sean is partner in Deloitte's healthcare advisory team. He's going to join us here for the event. Sean is particularly interested in the use of innovative technology and data to facilitate better understanding of management and health and human services clients and system performance. And with that, I want to welcome Sean to the event.
Thanks, Jeff.
Sean. Hi, Sean. Listen, I'd like to start with a question for you first, and sort of through your consultations, what have you seen as some of the other key challenges? We don't want to go too off piste, but what have you seen as some of the other key challenges that you've been working on that have been faced by the health tech industry?
Yeah, thanks, Jeff. Look, as I've been listening to the speakers, I think obviously the focus of the panel today has really been, moving things in and out of the country. And if I think to the consultations that we had with the sector, there's probably sort of three things that come to mind. One, which is, and Eric mentioned this as well, that it's also our domestic challenges that we've had with our own lockdowns. I guess the way that we've managed internally as a country movements and between states and territories. And I think, in particular, if we think about the sensitivity of timing around some of the products that need to be moved around with respect to the health tech industry, getting it into the country is kind of step one, and then moving it to where exactly it needs to be is kind of, the remaining steps. And, we've seen that including, that end-to-end picture, for people and for organizations is really key. So I guess point number one, our domestic challenges have definitely played into impacts for the sector. The second one is really, I guess we've sort of spoken a lot about moving things in and out of the country and now by extension within the country. The other piece is moving people. And, we're all, I think, in the same boat where we're probably all looking forward to getting out of the country and moving around, and whether it be on holidays or whether it be getting back to, doing business in areas outside of the country. And one of the things, I guess, at the more specific and technical level for some of the groups that we spoke to is actually getting really skilled technicians into the country that are needed for either commissioning, servicing, upgrading, critical infrastructure and equipment that they need. So, consumables, products are kind of the endpoint, but there's a bit in the middle that's required in a lot of cases to kind of make those things happen. And so, we heard that being, I guess, one of the areas, not being able to get those skilled resources in as being a real bottleneck. Even if you could get the products to where they needed to be, there's a piece in the middle in terms of the manufacture. The third piece is, I guess, again, coming to that point I started with, which is the limitations of being able to engage as effectively, and I guess we've all become experts at operating via video conference. I guess, like most of you, I spend probably most of my day looking at a camera now and a screen. But there are a certain number of things that I think we heard really do need some of that direct engagement with respect to new business development and breaking into new markets as export markets, for our health tech industry here. And obviously that's been an area that's been stalled a bit, not being able to get out of the country and engage in those sorts of things. And for some of the companies that we spoke to, there's a closing window with respect to competitive advantage, and obviously in health tech, and when we think about the cutting edge of what we have in this country, there is a time to market element to it, and that's been impacted, I think, by the pandemic in some respects, as much or even more so than some of our other countries around the world that might be facing similar things. So, I think when we sum it all up, and if I, sit back and think about all the conversation this morning, really it's one around predictability. We heard it a number of times, and Derek summarized a lot of the great activities that went to adapting to, these challenges. But the real key thing is just being able to be sure of what's happening and work around it. And I think what we've all been working with over the last 18 months in our personal and business lives has been that predictability piece. So, I think with opening borders, we're getting closer to, resolving some of those things, but certainly we've, as Marg mentioned, we're probably a little way away from getting back to, a bit of a normalcy, if we want to call it that.
No, that's great points, and part of, and I guess in looking back at what we've been discussing over the course of this morning, it just outlines the complexity of the issues that are going on. It's a bit of a Gideon's knot of issues all have kind of come together to create the situation we're in. And simply knowing that opening air freight and opening borders is not going to be a panacea for what ails us at the moment, and also to understand that if there isn't going to be a perfect clarity, there isn't someone out there who has all the answers to exactly how this thing is going to roll out over the next 18 months to 2 to 3 years as things come to whatever new normal they're going to be. We're monitoring, we're gauging, we're working towards being as proactive as we can and reacting where needed. And certainly you can hear all of that reflected in the conversations today. But we don't have a huge amount of time for questions, but I will get into a couple and then we'll wrap up. And I think one I just wanted to come back to, and I know we don't have perfect clarity to it, but the fact that the air freight through air freight support that's been provided through IFAM, International Freight Assistance Mechanism, has almost undoubtedly benefited people who are on this call, even if you're not formally part of IFAM. And that's because when flights are chartered, et cetera, there is going to be extra space. And the fact that our freight and the volume and weight of our freight per value is much lower, we're able to take advantage of that, and through the world couriers and others. I was wondering, in our discussions, Marg, I think over to you, is just, we don't have perfect clarity to it, but that as we get into this sort of period where we're transitioning out of IFAM through sort of middle of next year, is there any further insight on availability or insight to how we can leverage off that capacity that's been built through IFAM? And I'm not sure if I'm not trying to put you on the spot. I'm just it's trying to expand on where we are with that program and raise awareness with the audience around the fact that there is
Sure.
Sorry.
So a couple of the flights that are leaving Melbourne to LA now, they're ours. So we stepped in when the American Airlines pulled out. The good news is that American Airlines, I beg your pardon, and United intend coming back. So they've announced that. Air Canada is coming back. In fact, the Department of Infrastructure is just putting out their schedule, the next 6 month schedule, as we were just talking about, every 6 months. Some 40 airlines have expressed their intent that they want to come back. Now that's when they're doing the schedules. That doesn't mean to say that they won't cancel flights, but the opening up of Singapore will be interesting to see how much capacity is brought on through just commercial decisions rather than us. And I don't think we will be doing much different till at least Chinese New Year. And that will give us time to, because we review, I call it our RBA day. Every month we review the grant contribution, where we're putting on flights, do they need to be there? Up until now, we haven't cancelled any, but so I don't anticipate any changes till then. And that will allow us to see how it settles. So this whole issue about when will we get more air freight capacity as opposed to passenger seats? Will something else go wrong? I keep asking people, can they think of what else can go wrong? But I know hope's not a strategy, but I think the key this time is vaccinations and boosters. So there we go. So now all our flights are published on our website at Austrade, so you can see that. And there's an inquiry line. If you do have a shipment that's stuck somewhere or you're having trouble, you can ring us and we'll do our very best to facilitate that.
Great.
Margo, I think it's an amazing insight. You know, so many airlines that are wanting to come back, and it's all wonderful. The challenge we have is that it's one airport. It's the same.
Yes.
It's the same facilities, and we talked about some of the challenges being, you know, bringing the labour force back in and then training them up. Is that part of IFAM's support function, or is that something that's more on a local government where, with, you know, the support of BioMelbourne and Deloitte, that we need to be able to rally forwards? Because bringing in all these flights is fantastic, but if we don't have the capacity to handle it in those locations, it just creates a bottleneck.
Yeah, that's true. And I think certainly a role for government to play and the airports. What we have been doing, though, I mean, it's not in our remit, but because we can see these issues, we've just finished our 6th. We have what we call a supply chain summit with the states and territories, so that we can get these sort of issues on the table, and then for the governments to share what programs they have. And then we are looking at what measures could we put in place after we leave to continue to support exporters, and that's probably particularly around for Austrade. But Department of Infrastructure is also looking at programs, so that's not necessarily around the skills issue, but we're recognising that, you know, life will not be rosy after IFAM. We should be learning the lessons of IFAM and working together to put in, you know, education, training, infrastructure plans, advancing some of the infrastructure plans. I know the Department of Infrastructure are looking at establishing a strategic aviation forum, for example. And so we can start bringing all of these, you know, the different stakeholders together to see if we can get a cogent plan going forward.
Great. Well, those are great insights, and I think all of that speaks to the fact that, you know, from my background in manufacturing, knowing that there's unknowns allows you to start to plan for those things. Knowing that there's unlikely to be a return right away to prior arrangements and costs and lead times allows you some certainty with which to plan, and knowing that there are activities going on in the background at both the federal and state levels to address the issues, helps provide a greater level of assurance. And I think part of the program going forward with the working group is to, and certainly today, I think we've accomplished just raising awareness of the complexity and the type of issues that we're all facing, and will continue to face for some time going forward. So with that, I just want to thank all of our speakers today, Derek, Brent, Nathan Smith, Air Vice Marshal Mark Stabe, Eric Schmidt, and Sean. And once again, thank you to all the members and others from the sector who took the time to participate in putting this Insights report together. I'd also like to very much thank the Global Victoria for the opportunity to partner on today's event and support their Trade Alliance program. Find more about today the Global Victoria Trade Alliance, their range of programs to support Victorian organizations or to connect with one of their local, regional, or international trade specialists. Please head to the links provided on this slide. Alternatively, reach out to BioMelbourne Network. We can assist you in getting in touch with the right person. For those interested to learn more about the industry report discussed here today, we'll be sending out a copy and posted an email, and I believe loading that onto our website, and I here also to the Global Victoria website. I want you to thank you to all of our members and colleagues for joining us in this important discussion. We hope you found value in the information provided today, and we look forward to keeping you informed on freight and logistics matters in the months ahead. Following the close of the event, you'll receive a short survey which will automatically appear in your browser window. Please, I really ask that you take a moment to fill that out and leave your feedback. It's really important to help us guide the development events and of this nature. So with that concludes our event. So have a great evening, afternoon and evening, and thank you for joining us. Bye.